Healthcare is certainly a basic human right, a necessity. So I'll divide into two things, like how the healthcare is in the developing nations, like, America, and how the healthcare is in the developing countries. So let's talk about the US first. The most difficult challenge in the US is healthcare cost. There is some access issues, especially in the rural areas or senior living facilities, but the main challenge has been the healthcare cost. Take example of dementia, for example. It costed $360 billion to CMS Medicare. Similarly, the cost of like heart diseases is like almost more than that, or at least close to that. So those are the costs which are actually more than GDP of the countries in the world. And that despite all the healthcare innovation and efficiency and everything. So when I see this, I think the healthcare cost is mainly because of two reasons. The current model in healthcare in the US is fee-for-service model. So what happens, take the patient journey, patient gets admitted to the hospital. Most of the time it's because if they do not, there's more focus on the hospital-based business model. You get excellent treatment in the hospital most of the time. When you get discharged, that's where the problem happens. So you essentially don't get adequate follow-up, timely follow-up, I would say. And then these patients either go to homes, or they go, if they're senior population, they go to maybe nursing homes. And then there's a lack of that proper follow-up in timely manner, especially with chronic conditions. Patients keep coming back between the hospital and home, and each time they get admitted, it's essentially a higher cost. That's obviously from the acute side. But let's also talk about the patients who are essentially in their 40s or 30s. A lot of these diseases, chronic conditions, start at that age. There's not much education or focus on prevention side. So I think the healthcare system in the US also geared more towards, hospital focus or disease focus. Now it's a time to put more emphasis on the wellness side and prevention side. So that eventually we're talking about changing the model from fee-for-service to effective value-based care, or essentially in population health management model, where the big emphasis is on wellness, early detection, intervention, engagement. And I think that is the path to reduce the cost.